So, good morning, everyone. My name is Shazia Khan, and the unit you'll be doing today is Health and Social Care Provision. There's four learning outcomes to that unit, and then the assignment discussion. So, I'm just going to give you a little bit of an overview. It's Accentus awarding organisation, and this is just an assignment brief. How an assignment brief looks when it comes to doing the assignment on social health and social care provision. Okay, so there's four learning outcomes and one assignment discussion session. So this is just how the assignment brief looks, which will be discussed in more detail later on. Um, and we're going to be looking at four learning outcomes. The first one is to understand how health and social care provision is measured. The second learning outcome is to understand the roles of health and social care provision practitioners. The third learning outcome is to understand equalities in health and social care determinants. And the fourth learning outcome is to understand implications of ethical and legal issues within health and social care. And we've got these four learning outcomes, so there'll be one tomorrow as well session, okay? So this is just the assignment stuff which we'll look at later on anyway, okay? So I just wanted to show you an overview of this. All the information and all the recordings and everything is available on Moodle. Moodle is the main VLE, the virtual learning environment that is available for you to get on to get all your resources, your additional reading, your ebooks and anything like that. So you need to make sure you're using Moodle, okay? Is everyone okay getting on to Moodle? Niazi, Vida, are you okay getting onto Moodle? Right, okay, so we're just gonna start with the slides now. So we'll start the learning outcome one. So can you see the slides, everyone?
Yes.
You can see the slides. Okay, good. Thank you. So the first learning outcome we're doing is to understand how measurement of health and social care provision informs services. So this is looking at things like, data and things like that, So we look at the health related data, which is epidemiology, changing patterns in mortality, things like infant mortality. We look at social care related data, so birth and death rates, and data relating to people with mental health and mental capacity. We also look at the importance of demography, changes in population, age population, race and ethnicity, and common statistic means, median, mode, and percentage. And we look at the health and social care statistics. So, looking at health and social care statistics helps the health and social profession inform them of any sort of service improvements, any sort of resource allocation, maybe things like, ultimately things like bettering, the actual organization, making it better. So the first key terminology to look at is what is epidemiology, and this is the study of causes, distribution, and control of disease. So it's like an epidemic, okay, and it involves collecting and analyzing data around that, and trying to, identify what it means. So it's the study of how diseases occur and spread over people and why. Can anyone give me an example of where this may have happened in any country? Just recently we had an epidemiology, didn't we? Niazi or Vida?
COVID-19.
Yeah, COVID-19 did it have a big impact on, the whole world, as in people and, organizations and services? Did it have a big impact on that?
Yes.
Yeah, it's still having an impact, isn't it, Nayazi? It's still having that impact on people and, people having the aftermaths of COVID and things like that. So it occurs in different groups of people, this epidemiology, and it's groups of people and why and how the spread of disease affects the population. We have the next one, which is what is mortality? If you can see that. So mortality, when we talk about mortality, what do you think is mortality, Niazi?
The death, I think.
Death,
The
yes. So
death.
yes, you're right. It refers to the death of that has occurred due to like a specific illness or condition. So it could be diabetes, it could be dementia, it could be heart attack, anything like that. And then mortality is often expressed in the form of a mortality rate. So they measured on the diseases, measured on the time periods, and it could be the mortality can be broken down into maybe things like the age, the sex, and other factors can determine this. So these are things that are dealt with. And there's a new number of deaths due to an illness divided by the population. So mortality is something that is quite important within society to measure public health and how they track any sort of illnesses within that. So they have to make sure that they are on top of things when it comes to mortality. Infant mortality. Do you think there's more infant mortality? Vida, Niazi, do you think there's more infant mortality? So infant mortality, Niazi, what were you going to say? Do you think there's more?
Um, there is, I
Yeah,
think, some kids dead while
yeah,
complications and stuff.
yes, yeah. And when they're going through, having the baby sometimes, like you said, the complications, there are more infant mortality. So that's the death of a baby that occurs between the time it is born or 1 year old. And that can also be classified as things like neonatal mortality, which is another form of it. So infant mortality um, it's a key indicator that the society's overall health, reflecting maternal and child health, are the safety of the maternity services. So it is the leading cause of infant mortality is things like, them being born premature, birth defects, infections, sudden death as well, a syndrome. And it's up to the, World Health Organization to monitor all this and the child's health as well. The next one we're looking at is morbidity rate. And the morbidity rate is the measure of disease, prevalence, or incident within a population. So it indicates the proportion of individuals in a population who are experiencing specific illnesses. So it could be the morbidity rates refer to the state of having a disease or illness. It could be any distinct um, illness that they've got. And it could be things like it may be things like heart attack, it may be, diseases, things like, things like maybe dementia. It could be elements of that. So it could be, stroke, Alzheimer's, it could be, influenza, it could be cancer, it could be anything that, identifies that. Um, and it could be a long-term thing or a short-term thing. And the morbidity rates can be calculated for specific age groups or gender. Uh, okay, okay, thank you, Vadi. Thanks. Um, and then you've got factors that contribute. This is like generic environmental or behavioral elements of it as well. So that's morbidity, the rates, and then the next one we've got is demographics. And this is really important to look at the element of the study as well. And it's a various characteristics of a population. So examples of demographics can include such things as race, religion, race, sex, age of the population, and they look at the statistical information on the population, socio-economic, and it looks at the trends and the growth and the changes, and it can be used to identify the needs of different groups. So some examples could be things like, a demographic data can be used for age distribution. It could be used for ethnicity. It could be used for things like household income as well, which is an example. It could be used for whether someone is single or whether they are married. It identifies elements of that. So you've got gender distribution, and that is where it refers to the distribution of individual different genders. So this is the number of males and females in a given population, and this distribution may refer to how many men or women or what population or either in the group, and the gender distribution of a nation has remained steady for years, with women accounting at the moment for approximately 51%. So it's quite a big thing for women. The next one is ethnicity and race. And it refers to as exactly what it says, the ethnicity and racial groups and the disparities between both. You've got geographical distribution, and this refers to individual um, elements of things like, the aerial areas they live in, the rural areas, elements of health and social care between that areas in different regions. And then we have socio-economic status, and this refers to individual distribution across different social groups. So it could be disparities, it could be income, it could be employment. And these are important in regards to elements of trying to get data across. Social care related data, birth and death rates related mental health. So the first one is birth and death rates.
Hello, good morning.
Morning. Is it?
Sorry, I was at the mass Zoom, so I'm sorry I'm late
No,
here.
it's okay. Is it Latifa?
Yes, please.
Okay. It's okay, Latifa. So we're just looking at social group care related data, birth and death rates, data relating to mental health and mental capacity. Latifa, I will be asking a little bit of questions, and you can get the recording of this on Moodle then later, okay? So birth and death rates, and this is
Okay, please, can you send it on WhatsApp too?
no, I think what it is that they have to upload it onto Moodle.
Okay, all
Yeah,
right, thank
they'll
you.
have to do it and they send you it then, okay?
All right,
So
thank you.
it's okay. So the birth and death rates, this measures the number of births and deaths in the population. And why do you think it's so important to measure birth and death rates? Anyone? Latifa, I'll ask you. Why do you
Yeah,
think it's so
because
important?
it's important because for us to know what and the date when and then the time that it occurs.
Yeah. And
Yeah.
do you think we need it for data as well?
Yeah,
Yeah.
that's it. We need the data as well, to know what exactly happened.
Yes. And how they
Yeah,
died from what illness,
yeah, yeah,
Yeah, so we
yeah,
monitor the illness as well.
yes,
So it's really important to look at birth
yes,
and death rates.
yes. Thank.
Mental health. Now, this is another one that's really, really important. I mean, they're all really important, but it looks at the element of uh, things like, maybe uh, suicide rates. It could be mental disorders. It could be monitoring anyone who has depression or anxiety, and it is quite big in the UK. There's 1 in 6 adults who have mental health issues. So it's really important. Data is really important because it looks at how the incident occurred, how it's prevalent, and it's used to evaluate any sort of interventions that they can put in place so that there's not much deaths. It can include things like dementia. So if you know any sort of mental health issues or anything like that, they can prevent that because it could identify triggers for that, making sure that people they're putting more things in place to try and prevent this from occurring because someone's mental capacity is is quite that's the next one we're looking at, mental capacity. That is where someone is doesn't well has the ability to understand information on one's life. So it could be someone who doesn't have the mental capacity, someone who has dementia. It's important that you have data in place for that, because if they don't understand what they're making, anyone that has any mental conditions could fall under mental capacity, like schizophrenia or depression. Anyone that has learning disabilities or brain injuries, anyone that's had a stroke could fall into that. So it's really important that they offer the right support, and they have to make sure that they know what's going on and where the element of that is in place. The next one is the adult social care outcomes framework, which is called ASCOF, and that is a, a framework that measures how well care and support services achieve the outcomes that most people that matter most to the people. Because organizations need to check what's going on. And it's used both locally, ASCOF, and it's used nationally to set priorities for care and support, and measure the progress, and also strengthen transparency and accountability. It's there to measure things. And why is it important to have ASCOF in place? Niza? Yes. Yeah. Why do you think it's important to have ASCOF in place where it looks at measuring and reporting any sort of adult social cares? Ayazi?
Very important for you.
Latifa? Why is it important to have the measuring all this in place? Why do you think it's so important? I can't hear you. Okay, we'll move on. It's mainly important because it looks at the effectiveness of care and support that is provided. So these measures are organized in four domains, which is firstly enhancing quality of life, secondly delaying and reducing the need for care and support, and thirdly ensuring people have a positive experience of care and support, and fourthly safeguarding adults whose circumstances make them vulnerable and protecting them from avoidable harm. So each of them domains include indicators that are used to measure the performance of adult social care. For example, enhancing the quality of life, making sure that everything is in place, making sure that people have control over their daily life. ASCOF is used by local authorities to monitor and improve the quality of life. Here's a video you can watch in your own time. Skip that. 1.1, discuss the importance of data in health and social care planning. So data is really, really important. It plays a vital role in planning by enabling resource allocation. It may be delivering services. Effective data is crucial for addressing any sort of health and safety inequalities. The first one is identifying health and social care needs. So data is used to identify. What does it mean by identifying health and social care needs? Latifa, what do you think it means to identify health and social care needs? Why is data important to identify health and social care needs?
Hello?
Why do we need data to identify health and social care needs?
Yes, we need data to identify health and social care needs because we need to record,
Yeah,
we need to do our record to give us the information that the person went through, or how you treated the person. You need to record their
yeah, yeah.
yeah, yes.
So
You need
it's used to
record
identify the
everything.
needs, yeah, the needs and care of a population, if someone's got any sort of specific diseases. And
Yeah.
then monitoring and evaluating performance data can be used to make sure that, if there's any areas for improvement, not everything is perfect. There may be areas for improvement. So it may be resources,
Wrong with me.
looking at the outcome, are the resources more effective, ensuring the services where they are used are most needed. So monitoring and evaluating performance. Then we've got planning and resource allocation, whether there's a need to have resources in place, plan for future provisions. Data on aging population can be used. Supporting research and development data to use to support research and development for the future, such as any sort of trends in diseases or testing or anything like that. Supporting policy development, so data can be used to inform policy development, identifying areas of needs if there's any gaps within the services, highlighting whether new or enhanced services are required. And also, data on patient outcome allows for evaluation of effectiveness of existing services, whether they're used correctly or not. Then we've got explain 1.2, which is explain the influence of demography on service planning and delivery. So demographic factors include things like population, the age, the distribution, the ethnicity, socio-economic status, significant impact on services and planned and delivery. And these influence the types of services needed. Understanding these trends is really important. So understanding demography has a significant impact on the delivery of any sort of service. The first one is age structure, and this leads to the increased demand for long-term care facilities. For example, in an aging population, it impacts on any sort of age-related illnesses, and long-term on the younger population as well. It looks at services provided for them. The next one is geographical and culture, distribution. And this is accessibility and availability to health and social care services. For example, in rural areas, you may not be able to get services. So it looks at like urban and rural areas who have different demographical profile and service needs. Not every area has the same demographic need for it. Rural areas may face challenges in attracting and retaining healthcare professionals. And then urban areas may have a higher concentration on specific demographic like young professionals or elderly populations. Then we've got ethnicity and culture. The cultural needs. Why are the cultural needs so important? Ethnicity and data. Why do you think, Nayazi, why do you think the cultural needs are more important? Do we have people from the same culture? Latifa, anyone? Why
Yeah,
do you
we
think?
need to respect people culture because we are not from the same culture.
Yeah.
Everyone has his ethnicity and the culture, so we need to respect that. Yeah.
So language barrier is a big thing, Latifa, okay? So what would you have to provide to patients then? If language is a big thing and England proficiency, what would you have to provide?
Uh, you've got to provide interpreter.
Good. Interpreters, Niazi. And that would help it
Um,
because, language barriers, Niazi, is a big problem, isn't it, within ethnicity and culture. And we should make sure that, service planning is put in place to ensure diversity of different populations and ensure access to culturally sensitive care, make sure that they are part of the care service as well. Then we've got socio-economic status, and this looks at is often looking at things like the poorer health outcomes. The status is often linked to poorer health outcomes. Services need to be tailored and addressed to the needs of disadvantaged communities, people on low income, people including outreach services, and addressing any sort of inequalities and understanding the social, dynamics that people are from a lower income, they don't have a high income, so we have to try to address them issues. Health status, so the health status of a population can influence the demand for services as well as the different types of services we need. If there's an illness with a high prevalence of like chronic disease, again, going back to COVID-19, we did take into account that the demand for health and social care services, it was difficult at that time because everyone was getting, COVID, and the planning and delivery was very hard to get into place quite quickly. But we need to make sure the health status that we cater everything to the individual's needs and make sure that we are prevalent in that. That's why we need data to support that. So importance of demographic changes in population, age profile, race and ethnicity, regional differences, and distribution of population, trends for wider groups. How demographic data is linked to planning, making predictions, resourcing, and staffing services. So demographic data encompasses things like we said earlier, population size, the age structure, race, ethnicity, and regional distribution. And it's crucial for planning and making sure we put in policies in place and staffing in different aspects. And it allows for the predictions for future planning. And some of the areas we look at are changes in population size, and that will look at elements of, changes, how the impact has on services. For example, if there's a large number of aging population, things need to be put in place for long-term care services, while a growing population may require more schools and teachers. Demographic data on population size is important for predicting future planning. So it's really, really important that you will predict that for the future. So there's no elements of any issues around that. The next one is the aging profile population, and this is there's a greater need in for health and social care services and social support services. So a younger population may require more investment in education and childcare, whereas an older one may require more important areas of healthcare, long-term medication, and it would look at the age groups in regards to that. You've got race and ethnicity, and this is to identify any sort of disparities, as we said earlier on, in regards to any sort of data to improve cultural areas. It may be relating to discrimination, inequalities, and it's important to plan services that are tailored to meet the needs of different people from different racial and ethnical groups. Regional differences and distribution of population. And that could be things like elements of, like we said, in different areas, identify any sort of disparities of services between different geographical regions. And this is important for planning as well. And trends for wider groups, making sure that demographic data on wider groups of socioeconomic status can help disparities. And that could be looking at things like, making sure that the demographic data can highlight health and socioeconomic disparities among different racial groups targeted. And using data is really important to understand racial and ethnical makeup of a population, and tailoring services to their needs. Different ethnic groups may have unique health risks, cultural practices, and language barriers that require specialist, approaches. So we need to make sure that we are taking that on board when we are looking at the race and ethnicity one. It's really important. Demographic data is really important for planning and is a fundamental tool for resource allocation for delivery of services. And by understanding the structure and distribution of populations, governments, businesses, and organizations can make informed decisions and make sure that they are providing an effective service. It's really, really important that they make sure that they are providing that service for tracking any sort of change, making sure they're looking at providing a future plans as well. It's not something that, you just predict and, look at trends. You've got to provide for future planning as well. Why do you think demographic data is so important? Nayazi or Vida or Latifa, why do you think it's so important? Demographic data or demographic information? Latifa? if you provide data for like some of these areas, age, race, religion, culture, trends for regional, it's really important because you are able to look at the statistical findings from these elements. So maybe someone who has, illnesses around maybe cancer, dementia, you are able to identify that and put things in place for that. Common statistical terms, so we've got mean, medium, we've got mean, medium, mode and percentages and rates. So the mean is the measure of central tendency. The mean is average is calculated by adding all the numbers in a data set and then dividing by the total of number of values. For example, the mean of 2, 3, and 4 is 2 plus 3 plus 4 over 3 equals 3. It's to measure the central tendency, indicating the typical value in a data set. Then you've got the median, and the median is the middle value in a data set when the values are arranged in ascending order. If there's even number of values, the median is the average of the two middle values. For example, in the sorted data 2, 3, 4, and the median is 3. In the sorted data set is 2, 3, 4, 5, and the median is 3.5. And then we have the mode, which is the value that appears most often in a data set and represents the most common value. And it's calculated identifying the value that occurs most frequent in a set of data. We then have percentages, and these express a proportion or ratio as a fraction of 100, and they're used to represent parts of a whole in a standardized way. For example, if 25 out of 75 people in a population have a particular condition, an illness, the percentage of the people would be 25%. And then we have rates, which are express the relationship between two quantities, often with different units. They indicate how one quantity changes in relation to another. And it could be things, example, the mortality rate is the number of deaths in a population over a specific period of time, typically expressed as a rate per 1,000 or 100,000. And it's really, really important to understand these statistics, because it identifies elements of trying to figure out and interpret any data. So any findings are communicated through that, and researchers and practitioners can ensure that findings are understood and accurately represented by others as well. So it's really important to have these rates, median, mode, mean, percentage, and rates, because they all work differently, but statistically they identify elements of any sort of findings. Examples in the healthcare profession: suppose we have the following data on the number of patients with a particular condition who received treatment at a hospital over the 6 months. Using this data, we can calculate the mean, medium as mode. So January, we had 25 patients. February, we had 35 patients. March, we had 45 patients. April, we had 40 patients. May, we had 30 patients. And June, we had 20 patients. The solution here is that this can be calculated by adding all the value and dividing the number in the values. In this case, the number of patients. So it was 25 plus 35 plus 45 plus 40 plus 30 and plus 20 over 6, as it was 6 months, equals 32.5. Now, that was the mean. The median for it would be calculated by arranging the values in numerical order and identifying the middle value. In this case, the median number of patients is 25 plus 30, so 25, 30, and this is in the arranging the values in numerical order. So from lowest to the 20, 30, 35, 40, 45, and 20. Then we look at the middle value, is the average of 35 and 40, which is 37.5. The mode can be calculated by identifying the value that occurs most frequently. In this case, there's no mode as there's no value more than once that occurs. So we can also calculate percentages and rates using this data. For example, the percentage we looked at here is we can calculate the percentage of patients who receive treatment in each month by dividing the number of patients by the total number of patients and multiplying by 100. So the example for the percentage of patients treated in January is 25 over 195 times 100 equals 12.8. Now, if we look at the rates of it, we can calculate the monthly rate of patients receiving treatment, dividing the number of patients by the number of days in the month and multiplying by 30. And here we're assuming a 30-day peak month. For example, the monthly rate of patients receiving treatment is 25 over 31 times 30 equal 24.2. When we look at elements of this and in health and social care profession, why do you think it's so important to have these percentages and things? Why do you think, what do you think do you think it's an easier way for people to understand things? So it's mainly better to understand, communicate things in the health and social care profession, also look at patterns as well and trends. And it also ensures that the statistical data is valid and reliable. So, researchers can look at this and have a strong background into the statistics and look at data analysis, make sure that they look at investigating the different various collection of data, and it is identifies any sort of data set as well. So it's really important to use them because, it's a fair representation of any sort of data. Are you all okay with that? Is everyone okay with that? Bida, Niazi, Latifa, yeah?
Yes, please.
Okay,
Yeah.
excellent. Thank you. So reading and interpretation of health and social care related statistics uses and abuse of statistics. So health and social care statistics are crucial for understanding population health trends, identifying risk factors and evaluating the effectiveness of intervention. However, these statistics can be misused or misinterpreted, leading to flawed conclusions and potentially harmful decisions. So understanding how to critically analyze and interpret these statistics is essential for making any sort of informed decisions. So the first one is understanding the context. So it's really important to understand the context in which the statistics were collected and studied and the methods to collect the statistics to make sure that they're interpreted appropriately and correctly. Recognizing limitations. So all statistics, have limitations. So it's important to be aware of the limitations when interpreting them. So sampling and things like that, and when we look at misuse of and abused of abuses of statistics, you could have you look at things like cherry picking data and things which we'll go through a little bit. Looking at trends is looking at identifying patterns and changes, for example, comparing mortality rates over time, comparing groups, making sure that the different groups can be able to look at disparities. So different groups, different areas, for example, comparing cancer rates in one area, different ethnic groups and disparities, and making sure there's no inequalities. Being aware of any sort of abuses is really important. So making sure that statistics are not abused. Some elements of misuse and abuse of statistics is things like selecting only data points that support a desired conclusion while ignoring, the main things that are needed in place. Using data from a small group, individuals draws conclusions about a larger population. Another one, misuse of data could be things like manipulating graphs and charts to exaggerate things. You shouldn't be exaggerating anything. Another one is failing to account for the tendency of extreme scores, choosing the mean, median, or mode inappropriately, overlooking the importance of certain data and experiences. Sometimes failing to understand the socio-economic and political context in which the data were generated. It's really, really important to make sure that you understand, and read and interpret health and social care care statistics critically. Individuals can make more informed decisions and contribute to a more equitable, healthy society, it's really important that the statistics are not misused, because they are the primary tool for assessing any sort of relationship, evaluating questions, and sometimes they are misused, either inadvertently or because of ignorance or lack of planning. But it's really, really important, especially in health and social care, to understand statistics are used there to understand risk factors for communities, track and monitor health events such as disasters or diseases, and see the impact of policy changes. And it's all to do with assessing the quality of life. So if they're misused, it's not really important within, health and social care, because they play a significant role within health and social care to try and identify any sort of results and try to improve things for the future. So as it said, it's a critical and contextual understanding of data as an awareness of abuse of statistics. So we've finished learning outcome 1 now. These are the references we've used for today. There's ebooks and journals available on Moodle. I'll give you just a quick overview of what we've been through today in health and so in learning outcome 1. So a summary of today's session is we looked at understanding how measurements of health and social care provision informed services. We looked at the health-related data, so we looked at changing patterns, mortality, infant mortality, morbidity. We looked at social care-related data, birth and death rates. We looked at mental health and mental capacity, adult care. We also looked at ASCOF. We looked at the importance of demographic changes in population size, age profile, race and ethnicity, and how the demographic is linked to planning. We also looked at common statistical terms such as medium, mode, percentages, rates, reading and interpretation of health and social care, and statistics. We also looked at the importance of statistics and the abuses of statistics. So just going back to the plenary, there's lots of ebooks and journals available, or any sort of additional resources available for you on Moodle. There's health information, use of health service planning and evaluation. That's further reading. Pages 9 to 10, 61 to 64. It's a workbook on there. And there's a link there that you can go on to do some extra reading around the health information, around practitioners, and around the element of, statistics and data. Has anyone got any questions before we finish this session off today? Niazi, Vida, Latifu, have you got any questions? Any questions, Latifa? Niazi, have you
Yeah,
got
sir, please, about the assignment that you gave us last time.
last time?
So,
I haven't given you no assignment.
uh, okay,
The
so
assignment is available on Moodle for you. I just showed
yes,
you at the start the
yeah,
assignment brief, but that's in the recording. The assignment is available on Moodle for you, so you could have a
oh,
look at that. But what we do, Latifa, is we have the learning outcomes we do each week, and then we've got 4 learning outcomes and then an assignment discussion session, which we'll go through together, so it'll help you. But all the other resources are available on Moodle and the assignment brief, okay?
right,
Is
okay.
okay. Is there any other questions, Diazi, Vida? Any questions before we finish the session? The next session you've got is tomorrow, which is learning outcome 2. And that's at 10 o'clock, okay? And that's looking at understanding the roles of health and social care practitioners.
Okay.
Thank you. If there's no questions, thank you for attending today's session. And if you have any queries or anything, email learnerwork@ukvarsity.co.uk. And I will see you in tomorrow's session.
Yeah,
Okay,
thank
everyone.
you.
Thank you. Nice to see you all. Bye.